Body reshaping applies to the great majority of us North Americans because, in fact, we're all overweight. Liposculpture is not a procedure to lose weight. It's not something you want to do to lose weight. In fact, diet and exercise are by far the most effective methods to use that. And the whole array of spa technologies will help people who have difficulty, particularly with losing weight. So there's infrared saunas, there's radio frequency, there's all sorts of devices that will treat both cellulite and weight reduction if patients are overweight. But what do you do when someone's got a normal BMI and has love handles that they can't get rid of? It affects men because you can't hide them. It affects women because it raises their waist when they have a nice dress. Well, for this, unfortunately, there's no alternatives but liposuction. In the past, liposuction used rather large cannulas and general anesthesia. Nowadays, we do them with local freezing, tumescent anesthesias, and very small cannulas, far less traumatic. It's interesting because the smaller cannula remove more fat, less traumatically, and without bleeding. Someone can undergo a whole liposculpture of an abdomen or flanks or hips or inner thighs and lose about a teaspoon and a half of blood maximum. So it's quite remarkable how little blood loss there is with this. Not only is there less complication, less blood loss, but also less downtime. People get up after the procedure because, again, it's under local anesthesia. We give them a little snack and they simply walk home. The more active they are, the better it is. Well, one of the things that sets our clinic apart is that we are a full accredited non-hospital surgical facility. In fact, we're now in our surgical suite. We have two small surgical suites in which we do endovenous laser phlebectomies or microsurgery for varicose veins. We do hair transplants, we do eye surgery, blepharoplasties, and we do liposculpture in these suites. The surgical facilities, we're a non-hospital surgical facility. A surgical facility is fundamentally a space where you have a high pressure zone. So when the doors are closed, the pressure in this room is higher than all the other rooms. So flow goes from inside to outside. And that's what makes a surgical suite a surgical suite. The air is filtered. There's significant air exchange every minute, basically every hour, so that there's always good filtered air, and it reduces the risk of infection. That's what OR suites are for.